Hey, welcome back to Morning Joe. With us now, Republican Congressman Tom Cole of Oklahoma. Congressman, thanks so much for being with us. Obviously, the Wall Street Journal talking this morning about the failure of the Republicans over in the Senate. Do you see a way forward with just Republicans passing a health care bill, or is it time to start figuring out if moderate Democrats want to join in and somehow create something that moves Congress and this country forward?
Well, I think, and I don't want to be hard on the Senate. Look, this was tough all along, but I think the first thing that has to happen is they have to figure out what they can do, and that's not something we can help them with. We've got a bill over there. We did what we were asked to do. Now we need to see what they're able to do. Second, we hear a lot about working with Democrats and that we ought to fix Obamacare, not to just scrap it. But the reality is I haven't seen any fixes proposed by the Democratic side. And if the idea of fixing it is just more and more money into a failing system, that's never going to pass over here. So, again, I'm content to let the Senate sit down and sort through its problems. But they need to pass something, and then we can get to conference. Hopefully we can accomplish something then.
Well, Congressman, you did what actually the president and Steve Bannon and others had been pushing the House to do, and also obviously something that a lot of House members wanted to do. But then the president went around telling senators and others that your bill was, quote, mean. Do you think that may have caused some of the senators to pause before jumping off the cliff for this president?
I don't know. I don't think so, frankly. It's not unusual for presidents to sort of flatter the Senate to try and get them to do something. So I actually give the president a lot of latitude on that. At the end of the day, we knew what we passed wouldn't be the final product. They had to pass something over there, and then we had to go to conference. So I always felt like, that probably our bill would be further to the right than their bill, and we would meet someplace in the middle and hopefully have something that really delivered for the American people. But again, the Senate has to figure out now what it can do. If it's a bipartisan product, then they should get together, do that, and let's go to conference, because what we have now isn't working. It doesn't change the fact the Obama system is collapsing. My state, we're looking at 69% rate increases. We're down to a single provider. Our hospitals don't, we're not a Medicaid expansion state, so we're taking care of patients that we get no compensation for. So the system isn't working for us. And if the Senate can do something, then I'm more than willing to sit down and try and talk to them and see if we can find some common ground. But they have to pass something.
Something. Congressman, Republicans' inability to reach a deal so far in health care, I'm wondering if that's omen for the party's efforts on tax reform. Yesterday, the House Budget Committee took the first step toward overhauling the tax code by unveiling a $4 trillion budget proposal. That plan calls for reducing tax rates for businesses and individuals, but it also features just over $200 billion in mandatory spending cuts on social programs, including those for the poor. That move could once again, don't you think, divide conservative and moderate Republicans, Joe?
Not if, look, I sit on the Budget Committee in full disclosure, so I'm pretty proud of the product, and particularly of Diane Black, who's the chairman, and I think has worked with everybody. If you look at that $200 billion, that is out of more than $30 trillion worth of spending that will take place over a decade. So finding $200 billion out of $30 trillion and spacing it over 10 years shouldn't be that hard to do. But nobody around here has done it for a while, so I applaud the Budget Committee for actually going after where the real problem is at, and that's entitlement spending. All that $200 billion is entitlement, so they're to be commended for taking on the tough problem.
So, Congressman, what's next for the Republican House, for the Republican Senate, for this president? Do you move to tax reform, and does health care reform get put on the back burner?
First, we finish what we need to do this year, before the August break. That is, today, Joe will have finished passing out all 12 appropriations bills out of the full Appropriations Committee. Nobody's done that since 2006. Then next week, we'll pass a national security bill, which will include 4 of those: defense, energy, and water, and veterans and MilCon, and the Ledge Branch bill. And those will actually be across the floor before we go home. I think, again, we need to sit down with our Senate friends and listen. I think clearly health care goes to the back burner before, and at least until the Senate demonstrates what it can do. Tax I'm actually more confident about, although again, look, success breeds success. We did not have success here, so that's a setback. You got to be honest about it. But I think tax reform will give us an opportunity to come back, and if the Senate can get something together, we'll go to conference, because again, we need to do something to fix this health care system. It's not working for lots of Americans. The premiums are going up, the coverage, you've got people, providers and insurance companies exiting the market. The fact that we weren't able to get something done doesn't change the reality that this is a failing system and needs to be addressed.
Congressman Mark Halpern, good morning to you.
Hey, Mark.
Would you rather, all other things being equal, pass a bill that was voted not only by you on health care, but by Nancy Pelosi, or would you rather pass a bill without Nancy Pelosi?
Well, I'm not going to. Look, I've been willing to be part of deals. I'm just yet to be convinced that the Democratic leadership is ever for anything that's not more spending and more government. And frankly,
which is the better outcome from your point of view for the country?
Well, look, I think doing
a health care bill
something
with her support or without her support?
Well, I don't know that we need her support. I mean, look, we've proven we can move on our own. This is really a Senate issue. But at the end, I'm more than happy to work in a bipartisan fashion. I've demonstrated that over and over. But it's got to be for something that fundamentally fixes the system. None of our Democratic friends, frankly, talk about fixing it. They've never presented any fixes for it at all. And, they love this system. They bled and died for it. I get it. But it's not working. So I'm not going to buy into, the Obamacare system as is. It just, I need to see something a lot different that works for the people I represent. Right now, this system isn't doing that.
What would you say to a Republican voter out there who's looking at this and saying, hey, Republican Party, I voted for you in 2010, 2012, 2014, and 2016 to repeal Obamacare. You finally got the power to do it, and you couldn't get it done. I'm not voting for you anymore.
Well, I don't think that's going to happen, quite frankly. I think the House has delivered on all the commitments that it made, and I can't be held accountable for the Senate in that regard. But I also point to what's really in the House, a pretty brilliant, record of legislative achievement. I'll give Senate the credit for nailing down the Supreme Court for us. That was something they did all on their own. They should take credit for it. I think the economy is probably the most important single factor going into next year, and it's looking in pretty good shape. If we can get tax reform, I think we can actually goose that up and do even better. So, it's a little bit premature to throw in the towel, either politically or electorally right now. We have a lot we can do. We ought to focus on getting it done. Setbacks usually aren't final defeats around here. So, you just got to get up and go back to work.
Congressman, it's Sam Stein. There's a lot that the administration could do on health care without congressional input. For instance, they could be more certain about these cost-sharing subsidies. They could actually help publicize the law's enrollment plans. But what we heard yesterday from Donald Trump is that his preference right now is to, in his words, let the law collapse and fail. That could result in a lot of human suffering. Are you, as a Republican, comfortable with that approach from your party's president?
Look, I'm never comfortable with letting things fail or hurting the American people. And there is a lot that we can do. And frankly, there's a lot, to be fair, that Tom Price at Health and Human Services is doing. And we're moving other legislation. We moved medical malpractice insurance reform across the House floor a couple weeks ago. So you could start with that. You could do associated health care plans. There's some policy things where you might get some Democratic support. But again, in the end, left by itself, Obamacare is going to collapse. And the president's right about that. So if Democrats want to sit down and actually do some things to save it, fine. But if the idea we're going to throw in, billions and billions of dollars just to prop it up, look, this thing, we have 19 states that aren't Obamacare expansion states. And frankly, no matter what the CBO says, it seems to think they're going to become, they never will be. I know those states. One of them's mine. So this system, this two-tiered system, where all the country is paying for Medicaid expansion in 31 states, isn't going to last forever. So if Democrats want to sit down and talk about that, happy to do it. But again, so far I've seen no proposals from their side.
All right, Congressman Tom Cole, we always love having you with us. Thank you so much for spending time with us.